Welcome to Cardiology 101. This is Dr. Shiraz, and today we are going to discuss our supraventricular tachycardia, also known as SVT. So, as you might have heard, that supraventricular tachycardia is a misnomer because the origin of this arrhythmia is above the level of bundle of His, which is a part of ventricles. So, technically, it's not above the ventricles, so we cannot call it supraventricular tachycardia. But since historically and traditionally we are calling it a supraventricular tachycardia, we will go with this. All right. So what is the criteria for labeling SVT? Well, we should have our narrow QRS complex tachycardia in the absence of bundle branch block. See, when we have bundle branch block, what we see is slurring of QRS complexes, which is called aberrancy. All right. So in the absence of bundle branch block, we should have our narrow complex tachycardia. The rate can be, the rhythm can be regular or irregular, and rate would be around 120 to 180 and even beyond that. And there would be absent P wave, or there can be a P wave that can hardly be seen. It can be buried under QRS complexes, or it can be inverted in the inferior leads. All right, so this is our criteria of SVT. You can take a screenshot of this. Next up we have, if you look closely, our QRS is very narrow based. All right, our QRS complex is very narrow based, and we cannot see our P wave with any of the QRS complexes. We can see that the rate is very high. These are not the standard boxes, so I cannot calculate the rate here, but you can see that rate is very high, and there is absent P wave, and there are our narrow QRS complexes. So this is our SVT. You might also see that there is our ST segment depression with QRS complexes. Our ST segment is slightly depressed. So is this ischemic? Well, it can be ischemic or it cannot be ischemic. It is our rate dependent depression of ST segment. Mostly it is not ischemic, but it can be accompanied by ischemia. This is our first example. We can calculate the rate here. This is almost 1.5 large box. So if we divide 300 by 1.5, it is equal to almost 200. So the rate is 200 here. Our QRS complexes are narrow, and this is our T wave, and we cannot find a single P wave. So this is our SVT. Next up, we have another example. We can take lead 2. I can see that the rate is almost 200 here too, and the rhythm is regular. Our rate is 200, and our QRS complexes are narrow based, and we cannot see a definite P wave. All right, we can see a little bit of P wave here, but it is not prominent. So this is our SVT. Another example, what we have is our lead 1 is pointing upwards, lead AVF is pointing downwards. So as we have discussed, the axis is shifted towards the left side. If you haven't watched the lecture of axis determination, you should check that out. And our rate is regular here too, and our QRS complexes are narrow. It is tachycardia. We do not see a P wave, so it is called SVT. All right. So again, it is our supraventricular tachycardia. Here we can see that our QRS complexes are narrow based, and there is no definite P wave, and there is tachycardia, so we call it our SVT or supraventricular tachycardia. You can also see that ST segment is depressed, and it can mislead you to understand that this is our ischemic ST segment depression, but we have discussed that the ST segment is depressed because the rate is very high. Sometimes we have our ST segment elevation when the rate is high, and sometimes we do have our ST segment depressions. It is normal to have these with tachycardia. They may not be ischemic. All right. So that was it for our SVT. Next up, in the next lectures, we will discuss our ventricular tachycardias and ventricular fibrillations and SVT with aberrancy. So this concept is very important because sometimes you see a picture of SVT with slurring and aberrancy when there is also bundle branch block involved, And some people confuse it with ventricular tachycardia. We'll discuss how we can differentiate our SVT with aberrancy from ventricular tachycardia. So I'll see you in the next video. If you have any questions, comment them below and I will be happy to respond to them. Thank you.